All right, good morning. Let's get started here. Just gonna go ahead and share my screen with you. All right, thank you. Okay, so my name is Holly Christiansen, and here is my ID. You can see that. All right, perfect. So, like I said, my name is Holly Christiansen. I am going to be presenting my final capstone reflection project on optimizing the first 5 minutes of a code blue. My focus for this practicum was to streamline the initial chaotic response to inpatient cardiac arrest on med-surg floors. For my capstone, I designed and implemented the first 5 minutes of a Code Blue handout, which I will show you at the end of my slideshow here. I identified this opportunity because I realized that there is a lot of chaos in Code Blues that delay ACLS intervention. I found this opportunity to implement role clarity and reduce confusion and increase teamwork on inpatient floors. I've been a nurse for a little over 16 years, and well, actually all of them as an RN have been in the hospital setting. So I have witnessed firsthand, unfortunately, the stress and the chaos during Code Blue events. Currently, I work as a nurse at a busy Trauma One hospital, and I share my time between the shock trauma ICU and the emergency response team. So I do get to witness firsthand code blues in the ICU, obviously, and then on med surg floors as part of the emergency response team. So the emergency response team, we go to all the code blues in the hospital, rapid responses, and code strokes. Um, Outside of the ICU setting, so on like med surg floors, recovery areas, and sometimes the outpatient setting. So, due to the nature of these events, I have noticed the stress and anxiety of code blues in high stress situations. And I had felt like I had noticed a decrease in patients receiving ACLS intervention, like time to first defibrillation, on med-surg floors. So that was something I wanted to try to fix and get better. So, my initial goal was to provide benefits like decreasing staff anxiety during Code Blue scenarios. I had the goal to decrease the chaotic atmosphere and then, in turn, be able to meet my second goal, which was decreasing the time to defibrillation. For this project, I aim to decrease the chaotic atmosphere and potentially reduce the time to first shock. For myself, I wanted to grow in my abilities in leadership, education, and research, which is something I honestly haven't had much of an opportunity to do before now. And I wanted to be able to transition from being a clinical peer to more of a nurse leadership role, advocating for quality improvement. The primary purpose of my practicum goal was rooted in patient safety and staff well-being. By decreasing chaos and stress with my infographic handout and training, I aim to ensure high quality CPR is delivered consistently while reducing the cognitive load on staff in high stress simulations and situations. The whole purpose of this project goes back to compassionate care for the patient and the team, including the nurses. By design, a training plan that provided a clear structure helped outline expectations, and we took the pressure off the bedside staff. When the team feels safe and confident in asking questions, the patient gets safer, faster, evidence-based ACLS response. Doing this on busy med surg floors was challenging. Acuity is high, and nurses are crazy busy trying to provide excellent patient care while on shift. So I found it hard to be able to pull staff off of the floor and away from their work, and that just wasn't realistic. So I quickly realized that I needed to pivot and do shorter, more repeated simulations during beginning of shift huddles. And then I also tried to hit like some staff meetings and things like that. It was tough logistically, and coordinating everything wasn't always easy. And I found that some of the more seasoned nurses were resistant into wanting to join and participate and listen to my education, my spill. Um, and then also, as my role as the emergency response team, we teach all of the mock codes to various units when they sign up. Given that I didn't teach all of the mock codes and not everybody had mock codes in the quarter that I was doing my capstone project, I wasn't able to teach everybody in that way. But during the mock codes that during the mock codes that I did teach, I was able to, teach some, which was nice because teaching mock codes is obviously deep rooted in following ACLS. So I was able to reference my poster during those teaching sessions, and I was able to hit home the point of decreasing time to defibrillation, and we were able to practice that hands-on. I was also able to talk to some staff members about their anxiety that they experienced during Code Blues, and I was able to hand out my survey that I did based on anxiety to the staff that were at those mock codes. Working with my preceptor was awesome. Her name is McCall, and we originally started working in the ICU together, and now we work together on the emergency response team. So we were able to meet up and discuss my project every week and sometimes more often. She did travel out of the country for a couple of weeks during my project, but it was amazing because she was willing to meet with me virtually, and I thought it was great that we have the technology these days to do so. When I hit roadblocks, she helped me keep my spirits up and helped me keep going with my project. Having that ongoing revision and flexibility made this project so much better, and the workflow go better. McCall is a driven nurse who has similar goals and aspirations as me, and is interested in seeing the success of the emergency response team, which we are both a part of. Um, and where it's a new department and a new role for us, and at the hospital we're at, we do feel like we're constantly under a microscope. So we're always trying to do our best. And so it was nice to work with somebody who supported my goals as well. The data I collected via survey and reviewing code sheets was that there was an increase in anxiety in staff members during Code Blue events. And I also found that there, in fact, was a delay in the start of compressions and defibrillations during Code Blues on the med-surg floors. Again, given that I'm part of the emergency response team, my manager has access to all of the code blue sheets. So I wasn't able to like share those obviously on here, part of HIPAA, but I was able to review those. And I did see a difference between the time to defibrillation noted on the code sheets from those coming from the ICUs versus the med surg floors. And then as far as the staff, I was able to do a quick and easy survey that didn't take much of their time, that I handed out at the beginning of my project, and then again at the end of my project, asking four simple questions, having them rate the questions on a scale from 0 to 10, asking about their anxiety around code blue situations. So I just wanted to share that survey, the survey questions that I handed out. So, question number one was, I am fully aware of my specific role and responsibilities when a code blue is called on my unit. Number two, I feel confident in operating emergency equipment, i.e., crash carts, AED defibrillators available on my unit. Three, I experience a high level of physical or mental anxiety when a code blue is activated. And four, I feel supported by the emergency response team when they arrive on the floor. I felt like all of these questions were important and didn't just hone on only on their anxiety, but gave me something that I was able to like focus on and help fix. After my project, I found that staff reported a decreased anxiety in relation to code blue events. Um, Also, after my project wrapped, I found that there was a decrease in time to delivering the first shock. The one thing that I do regret in handing out my survey and looking back, and maybe I would change in the future, is I wish that I had done like a QR code that people could just scan. Number one, I think it would make it easier to collect the results where they would all be digitally, but also might make it easier for the staff. But at the time, I was thinking like I didn't want people on their phones feeling like stressed that they had to be on their phones during and like while on the clock. And I didn't want anyone breaking any of the house rules being on their phone at the desk and whatnot. So maybe something I would change for next time, but I think it's always good to stop and reflect on those things. The organizational benefit was simple. We reduced the chaos and made our code blues safer by aligning with ACLS timelines. Beyond that, the visual guide that I made proved the value of a structured training approach to the nurses on the med surg floors. I proved clearly defined learning objectives, support vital skills, and decision making. For me, this project validated my clinical judgment. It showed me that I can take research, design, and clearly defined learning objectives and actually translate them to practice synthesis. It strengthened my beliefs that experienced nurses play an important role not only in patient care, but guiding the next generation of nurses, which is something that I take pride in. In summary, my project successfully implemented standardized structure to fix that code blue chaos. This experience strengthened my leadership and teaching abilities. The outcomes showed the value of clearly defined learning objectives, supported by the visual handout, and it outlined expectations, built confidence in stressful events, and promoted better closed loop communication, therefore promoting and bettering patient care and patient outcomes. Looking ahead, this experience has increased my confidence in my ability to mentor others and contribute to a positive learning environment. Teaching in front of a large group or even a small group of nurses or anybody in that matter used to cause me a lot of stress. However, being able to teach this often with this project has helped boost my confidence. It has been amazing to be able to see my hard work and teaching make a difference, which in turn makes me want to be more of a leader and a mentor to those around me. My goals moving forward is to possibly start my master's, whether that's my master's in education or leadership, and then possibly moving into getting my nurse practitioner. But in the meantime, I want to apply for further nurse leadership goals. Compassionate care, excuse me, compassionate care for our colleagues is so vital, And I hope to integrate ongoing revision, evaluation, implementation, and flexibility into everything I do into my future leadership goals. And I want to be able to pay forward the mentorship that I have received. Thank you so much for listening to my presentation and for giving me the opportunity and the push to be able to do a project like this and to help my confidence grow. I just wanted to show this, and I don't know why it's so fuzzy, but this is a copy of my poster handout that I did that shows what to do during the first 5 minutes of a Code Blue. And I like this because I thought it was aesthetically like pleasing to look at and had pictures and typed font to go along with it. So people can reference this. I would like post them in break rooms and like in the bathroom. So when people had like downtime, they could look at and review this. So it went over in the first 5 minute or first minute, which is your immediate action, which is the golden minute, which is to check for a pulse, call for help, flatten the bed, and then start CPR. And then in minute 1 to 2 is the airway, get an IV, put the monitor on. And then this minute, like 2 to 3, which is when we talked about heavily on delivering a shock, which is something that we missed. And then minutes 3 through 5 are on there. But anyways, thank you so, so much again for listening, and I hope you have a great day. Thank you.